Hello and welcome to another episode of Sound Strategic, the IISS's podcast series. I'm your host, Meia Nouwens, and in today's episode, I'll be speaking with Dr. Tim Huxley on how COVID-19 has impacted countries in Southeast Asia and the wider Asia-Pacific region. Tim is the Executive Director of the IISS Asia office in Singapore. He leads the IISS Asia's research program and has worked for many years researching security affairs in Asia, with a particular focus on the defense policies of Southeast Asian nations. Thank you very much for joining us today, Tim.
Thanks, Meia. Glad to have the chance to talk to you.
So maybe just to start us off, I was wondering whether you could share with us how the situation in Southeast Asia has evolved in the last few weeks with regards to the COVID pandemic.
Well, that's an interesting question, partly because it's challenging in the sense that, as in many areas of Southeast Asian life, it's very difficult to generalize about this sub-region because the countries in the region are so varied in terms of their size and their culture and their political systems and their relations with the rest of the world and their levels of development. But I think the main point is that perhaps compared with the situation in Europe and North America, overall Southeast Asia has done pretty well in terms of the way that it's coped with the COVID-19 crisis. There's a lot of variation across the region, though, and some countries maybe are not doing so well. I suppose particularly Indonesia and the Philippines, where there have been quite a few thousands of recorded cases in each country and several hundred deaths. So Indonesia has around 7,500 cases recorded, Philippines around 6,700, Indonesia 635 deaths, Philippines 446. But I think there are good reasons for thinking that in each case there are many more infections in each country, and that the figures we have probably show only part of a much more worrying picture. But it does look like we're seeing deaths in the hundreds or few thousands at most in each of those countries, and those are the worst national incidences of COVID in the region. In other Southeast Asian countries, in some cases looking at several thousand infections, Malaysia and Thailand, in Vietnam and Myanmar and Brunei, maybe only hundreds. But again, in Myanmar's case, maybe there are reasons for doubting the official statistics. The interesting case is Singapore, where we now have more than 10,000 recorded infections in a country of only around 6 million people, and the number of infections here has gone up rapidly over the last 10 days or so, and that's raised a lot of questions about Singapore's approach.
That's really interesting. Maybe turning back to the differences in experiences between Southeast Asian countries that you mentioned, I was wondering whether any conclusions have been drawn as to why those differences exist. You've mentioned different levels of socioeconomic development, perhaps different abilities to leverage national health care. I'm wondering whether, of course, the ability to control and monitor movement of people and enforce social distancing has been a factor. Can you perhaps speak to some of the key challenges that some of these cases or countries where we've seen a higher number of deaths and infections, what the factors might have been that lead to that?
Yes. Well, the two key countries here are Indonesia and the Philippines, and I think in each case, um, the relatively high figures reflect a relatively relaxed attitude in the early stages on the part of the governments in both cases, whereas contrastingly in two other major Southeast Asian countries, Malaysia and Thailand, the governments have been much more active, particularly in Thailand's case, and also in Vietnam's case, of course, where the government has been remarkably successful in controlling the level of infection. It's been very active from an early stage.
And here in Europe, we are constantly talking about the role of regional institutions. So, the role that the Union has played, whether European unity has seen challenges posed by responses and cooperation when it comes to combating the epidemics in member state countries. And I'm not going to compare and equate ASEAN with the European Union, of course, but has there been a role of ASEAN that you've seen throughout this crisis, or has it been a very much national effort?
Hmm. I think the responses have been very much national, as they have been in Europe, and that ASEAN's role has been um, no better or worse than the Europeans' role in relation to this crisis. That I think it's a characteristic of responses to COVID-19 across the world that national responses have predominated, and that uh, regional organisations and also international organisations have been largely missing in action.
Do you foresee that ASEAN perhaps could play a role as countries um, find exit strategies? And perhaps it's too early to say, but might there be a role for ASEAN coming out of this?
No, I don't think so. I don't think ASEAN's role is going to be very significant in relation to this crisis. I think it's widely known that ASEAN has faced many challenges uh, in relation to some of the other major issues facing Southeast Asian governments, particularly in terms of their responses to uh, uh, territorial disputes in the South China Sea, and even even on other security issues. ASEAN's role has been fairly fairly minimal. There have been real difficulties in coordinating national responses, and I don't see ASEAN playing a major role in response to this crisis. Of course, ASEAN ASEAN governments have remained in contact with each other, and there are uh, uh, a lot of bilateral contacts between governments. But at the multilateral level, although they have had some virtual meetings and have discussed coordination and the need for it, I don't think it's going to have a significant role to play here.
And how are national governments, leaders in particular, of Southeast Asian states being impacted by this in public opinion polls? We know that in some countries, government national leaders have seen an uptick in popularity, sometimes because of their response and other times despite their response, becoming more popular in public opinion polls. And in others, notably Japan, we've seen a recent downtick in Abe Shinzo's popularity ratings. How are governments in Southeast Asia faring?
Well, in general, that sort of popularity polling is not is is not it either doesn't happen for legal reasons, or it's not widespread. It's not really a factor in Southeast Asia. But I think the perhaps a larger point is that it is important for Southeast Asian governments, as it is for governments anywhere else, to respond as effectively as they can to this crisis, and governments in this sub-region face the same challenges that governments anywhere else face. That on the one hand, they need to be seen to care about saving lives and protecting the health of their citizens, but at the same time, they need to look after their country's economies, because the well-being of their citizens, and who in some cases in Southeast Asia are also electors, and even if they're not electors, regimes need to be conscious of public attitudes towards the state. So it is important for them to do as well as they can in this crisis. And again, it's about protecting lives, but also protecting livelihoods. And I think one of the really important issues, the most important issue for regional governments, is to get that is to do both, to protect lives and to protect the economy at the same time. And that's proving very, very difficult, because in practical terms, it means what sort of measures do you impose in terms of lockdowns, in terms of curfews and so on, in order to maintain social distancing, and how do you do that in a way that doesn't kill economic activity at the same time?
No, you're absolutely right to say that that's a challenge that every country is currently battling and struggling with, getting that timing right of reopening the economy and relaxing social distancing measures. I know that that's an ongoing debate in the here in the United Kingdom at the moment. But maybe turning to countries that are playing a proactive role, perhaps, in making a show of assisting other countries struggling with the pandemic. In recent weeks, we've seen China export very publicly a lot of its PPE equipment and medical aid. Has China taken an active role in helping Southeast Asian countries during this crisis? And what has the reception of this Chinese outreach been like in the region?
It hasn't really been a major phenomenon in this region. There are countries with especially tight relationships with China, notably Cambodia. But in general, there's great ambivalence amongst Southeast Asian governments in their relations with China. But I think the key thing to bear in mind is that so far countries in Southeast Asia haven't really faced a crisis on the scale that European countries and the United States have in relation to COVID. We're talking about generally we're talking about thousands of infections and scores or hundreds of people dying. In Southeast Asia, we're not talking generally about many tens of thousands of infections and thousands of people dying. So the scale is quite different. And I think it's true that in Indonesia and the Philippines, governments are facing something of a crisis, and it's a very important issue in Singapore and Malaysia and Thailand. But it's not the extreme sort of situation at the moment that we've seen in Western countries, and which has provided an opportunity for China to step in and offer assistance.
That's a markedly different experience than what we've seen in Europe. You're correct. And here, I think there's been a concern about China's attempt to use mask diplomacy or medical aid diplomacy to generate a new narrative over its handling of COVID-19, not only in relation to its response to its national epidemic earlier this year, but also in terms of where the disease, where the virus originated from, whether that was China or, as certain Chinese diplomats have stated, Italy or perhaps even the United States. Are these types of narratives resonating in Southeast Asian countries?
No, I don't think in Southeast Asia there's huge interest in that conflict of narratives. I think it's it's widely understood in this region that the virus originated in China. Many of the early infections in Southeast Asia apparently came with visitors from China and specifically from Wuhan. So I don't think there's any controversy about that here.
I was wondering, very early on in China's epidemic, we saw around the world a discussion of whether flights and borders should be closed, and particularly with regards to movement of persons from China abroad. And I noted that there were several countries in Southeast Asia bordering China who had not closed their borders early on. Do you think what was happening there, was that a political decision, or was that a more an economic one?
Well, I think the same as everywhere else. Southeast Asian countries were there when this infection began to take hold in China. There was uncertainty about how serious it was and how infectious it was, how easily it could spread to countries in this region. There was a concern to keep economies going, to allow visitors from China, who are a very important part of the tourist trade in Southeast Asia, to continue entering the country. And as it became as the COVID-19 crisis in Wuhan and the surrounding area and other parts of China became more evident, there was escalating concern in Southeast Asian countries that had significant numbers of Chinese visitors, and they began to make it more difficult for visitors from China to come into the country. But I think it's probably reading too much into the responses of Southeast Asian countries to overlay some sort of geopolitical angle on that.
Okay, but maybe moving on to existing diplomatic tensions in the region. Before the pandemic, many countries in Southeast Asia had ongoing disputes with China over its claims to the South China Sea. How has the crisis impacted this?
I think the main way that it's impacted this is that Southeast Asian governments have been focusing, like governments elsewhere in the world, on their responses to the challenge from the virus, and that maybe their bandwidth has been restricted, so they have relatively less attention to focus on the security sphere. I mean, it is clear that while that's been happening in Southeast Asia, China has apparently maintained its activities in the South China Sea, and has maintained its pressure on the claims of Southeast Asian countries. And we've seen over the last several days that there's been something of an escalation in tension between Malaysia and China, and I think other Southeast Asian claimants in the South China Sea, notably notably Vietnam and the Philippines have also been concerned about continuing Chinese activities. But I'm not sure that there's any evidence that the Chinese have escalated their activities. I think it's more that they've continued doing what they've been doing for many years in the South China Sea.
So you don't think that this crisis and the potentially the fact that national governments are perhaps distracted by their national epidemics and the COVID-19 outbreaks in their respective countries has provided China with an opportunity to perhaps push the boundaries a little bit of what it can get away with in the South China Sea with regards to its activities and claims.
I think I think one implication of the fact that Southeast Asian governments are somewhat distracted at the moment may be that China can get away with more, um, and maybe that explains why the United States seems to have been increasing its naval presence as well to in a way to preclude China from benefiting from the distraction of regional countries.
Right. No, that. I would very much agree with you on that. Because of course, whilst we've seen reports of outbreaks on U.S. carrier vessels, we of course haven't seen a complete withdrawal from the United States with regards to its naval presence in the region. Um, do you think that this was also the case for China? I've seen a few reports of how the PLA has been impacted by the outbreak of COVID-19 in China, namely supply chains for the defense technological and industrial base being disrupted, like any other industrial base. That there were outbreaks on smaller PLA Navy vessels. Of course, the military itself has been put into action in China, with particular note to its logistics units and its medical units. How has the PLA been affected from your perspective?
Well, it's much harder to know than it is in the case of the U.S. armed forces because of the openness of the American system compared to the very closed and secretive nature uh, of the Chinese PLA. But I think it's reasonable to assume that they they're facing a similar sort of challenge, and that they've been facing it since rather earlier than the Americans have. Uh, However, I mean, given the rigorous procedures that China is evidently able to put in place to control infection, um, I expect that those are going to be have been applied within the PLA with a strong degree of military as well as party discipline. So, um, so I would expect that the PLA has done a good job in controlling infection and ensuring that its operational readiness remains as high as possible. It could be that the Chinese have done a better job of that than the Americans have been able to do, but that's just speculative.
And how do you think that is going to change the power balances around the South China Sea, but also more widely in the Asia Pacific? Do you think between claimant states, but perhaps also the United States and China?
Well, I think the big question is how um, is how COVID-19 ultimately affects the economies of the countries concerned, and the big issue is what will be the relative damage done to the Chinese economy and the US economy and the Japanese economy, and how will that then feed through into their capacity to maintain their defence efforts, and to and to continue the modernization of their forces and to uh, support a high level of operational readiness. So, uh, in terms of the overall regional power balance, I think the big danger is that this COVID-19 crisis could lead to a really damaging medium to long-term economic impact in the United States that could ultimately undermine the United States capacity and possibly even will to remain vitally involved in the security of the Asia Pacific region, and that at the same time that happened, if China maintained its capacity and will to strengthen its posture in the region and to continue its drive for strategic supremacy in the Asia Pacific region, then I think that could be significantly destabilizing.
Absolutely, and of course, even before COVID-19, there was a question, I think, about the absolute guarantee of American commitment to the region, in particular its relationship with Southeast Asia during the Trump administration, and how strong that commitment actually is, whether deeds match words. I was wondering then what what Southeast Asian countries' perceptions have been towards the U.S. and China's handling of the crisis. I know that, not to generalize, of course, again, but Southeast Asian countries have been wary of being put in the middle and choosing sides in the era of great power competition between the United States and China. What have their perceptions been throughout the pandemic of how the U.S. has handled the crisis and what its role has been in the region during the crisis?
Well, again, going back to the point that I made at the beginning, it's very difficult to generalize about Southeast Asia. On the other hand, I think it is fair to say that China has a strong and fairly persuasive narrative on the way that it's handled this crisis, and it is evident that they do seem to have brought it under control. They do seem to be gradually returning to some sort of normality in China. I mean, this is a hugely contentious area, and we've heard all sorts of claims from Western sources that the Chinese have actually suffered significantly more infections than they've admitted, and more deaths. However, there's no evidence of that. These are all suggestions and allegations, and I don't think that Southeast Asians have been persuaded by Western allegations about China's underaccounting for COVID. So I think the Chinese narrative is not particularly challenged in Southeast Asia, and what Southeast Asians see is that most Western countries, most of the larger Western countries, do seem to have suffered very badly from this. I mean, with dreadful levels of infection, and it could be said that the level of competency in dealing with this challenge seems to have been much higher in China than it has been in Western countries.
Yeah, I think the point that you make about the accuracy of numbers and reporting is a very good one. I think underreporting, perhaps, whether intentional or not, has been reporting has been difficult because of changing methods of testing, changing definitions, an understanding of the virus as this has moved along, underreporting perhaps of deaths not in hospitals that might have been attributed to COVID-19. So I think you're right to say that this is a very complicated issue that many countries, not just China, are struggling with. Um, Perhaps to end on the last question, returning back to politics in some of the key Southeast Asian countries that are currently facing the largest challenges. Do you think that there will be um, domestic political consequences for the current governments in charge? Will we see new leaders emerge? Do you think?
I think this is a very early stage in what's going to be a protracted challenge for governments around the world, including in Southeast Asia. The, the the countries where this could develop into a political challenge, though, um, would would probably be Indonesia and the Philippines, um, where um, where this could develop into um, a crisis that does undermine the, the the credibility of the existing governments. Um, one very important aspect of this, of course, will be how it affects the economy. So, um, if 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 these governments of some of the larger Southeast Asian countries want to maintain their country's economic vitality and health, they might need to take risks in terms of um, not not clamping down in terms of maintaining social distancing. So one way or another, they could face major problems over the coming months, and it's clear that also because of what's happening in the wider region and the wider world, their economies are going to be impacted. So I think the the, the two countries to watch at the moment are the Philippines and Indonesia. Elsewhere in the region, at the moment, the problem looks relatively well managed and under control. I should just mention the specific case of Singapore. There's been a lot of publicity over the last 10 days or so about the rising numbers of infections recorded here. Um, that's true, and nominally, Singapore now, with slightly more than 10,000 infections, has the largest number of any Southeast Asian countries. But I think the real numbers in Indonesia and the Philippines are much larger than the numbers recorded for Singapore. Even so, 10,100 cases is a lot for a country of 6 million. But the key point about this is that these infections are largely in the within the community of immigrant workers, particularly the construction workers, rather than in the wider Singapore community. So I think there's still very much a sense in Singapore that the situation has been managed effectively, and that the government has done a good job in responding to this crisis. And I think it's particularly striking that even 3 months into the COVID-19 challenge, only 11 people have died in Singapore. And I think that's a testament to the way that healthcare has been mobilized and focused on those who are sick.
And of course, I assume that Singapore has learned from its previous experience with SARS in the past, building on that.
Yes, I mean that's a good point, and I think one that could be applied to other countries in Southeast Asia. and also perhaps to the East Asian region more generally. And maybe that's one factor that overall helps to explain why Asian countries have, in general, performed quite well in responding to this COVID challenge.
Maybe then a very, very last question. On that note, do you think that there might be a longer term geopolitical effect of the crisis by bringing more authority to East Asia in their handling because of their handling of COVID-19?
That's a big question. I do think that in the big picture, there might be questions about the effectiveness of governance in Asian countries, very broadly defined, compared with Western countries. I think the issue is how is it that Asian countries, which one would have thought would have suffered more seriously than Western countries from this virus, have by and large, at least so far, in many cases managed to respond to it more effectively than Western countries, and that may raise some interesting questions about the nature and effectiveness of governance, which may benefit some political systems in Southeast Asia, which are not liberal democratic regimes.
Well, I think that is a very big picture and very good point to end on, and one that I'm sure that we at the IISS, both in London and at the IISS Asia office in Singapore, will be tracking as the COVID-19 pandemic continues to develop in the months to come. Thank you so much, Tim, for joining us today and sharing your insights into the region. It's been a fascinating discussion.
Thank you very much, Meia.
And thanks to our listeners for joining us today. Please also subscribe to Sound Strategic for more in-depth discussions just like this. And to keep up to date with the latest trends in defense, international security, and armed conflicts, please follow us on Twitter, Instagram, and Facebook. See you all next time and stay safe.